we believe now that Governor Reynolds and the Republican legislature is probably not going to change from having privatized Medicaid. But we still believe there are fundamentally different things that we can do to make this service better, and especially for the people of Iowa that are using the services and for the providers.
And yesterday, Director Randall talked about a providers group that he's meeting with and taking into consideration some of the things that have been lackluster or problems or possibly even opportunities. And what we told him was that we would hope that he would also take into consideration the people who have dropped out of providing for Medicaid recipients, primary care physicians and dentists who have dropped out of the Medicaid system because they feel that reimbursement is too low and that they are not being paid on time.
So our bill carries probably 5 or 6 particular items that we think are important to address, and one of those is MAT, which is what it's called, but it's medication-assisted therapy. You talk to any substance abuse provider, they're going to tell you when you have an opportunity to help someone that you need to do something immediately. And MAT helps people reduce their cravings. And when you have to wait and miss an opportunity or send someone home, you run the risk of an overdose or even worse, possible death. So we think one of those things would be to not have to prior authorize something like that, because the treatment is so important, so standardized, and so important that it could save lives, that we think that that's one of those items that we could not have to prioritize or to have prior authorization. The prior authorizations that Director Randall talked about yesterday, he mentioned that they also are looking at not having as many that people would have to prior authorize before they get the treatment. And we thought that was hopeful, and that we would certainly like to encourage him to look at more than the list that we weren't able to see, but we really do want to see some of those things, especially like the medication-assisted therapy.
So the bill is being called an omnibus bill. So as Senator Ragan noted, there are several things in this bill. And one of the things that I'd like to talk about is external review. In talking to people who are Medicaid members and providers, it seems like the hang-up has really been some of the appeal process. So a claim is denied, it goes back through the system, time lapses, there's conversation between the provider and the managed care organization, and then it just strings out and it goes on and on and on, and then there's no appeal process that is fair for the provider. So what we're asking for is an external review to do that. Imagine going to your child's high school basketball game and the other team brings their own referee. That's kind of what's happening right now, is that the managed care organizations are deciding how they're going to be paid and when they're going to be paid, and it really doesn't give much leeway to the appellate process for the provider. So we're hoping that Director Randall and Director Foxhoven will take a serious look at that provision of the bill specifically to make sure that there's fairness. It's all about fairness.
We also, have addressed the long-term support services, particularly taking that out again. We think that is an important piece that should never have been in the original privatization, and we continue to ask that we look at that. So at that point, I think we should open it for questions.
Who would do the external review? Is it in the bill?
Yes. There's a process in the bill that would describe how the external review could take place.
I mean, private insurance does that now, so.
So it'd be another insurance company to look at it? Or?
There's a particular process to do it, third party, right.
So your preference is obviously that we would not have privatized Medicaid in Iowa. Obviously that's not going to happen. Do you think this system is fixable? Do you think it's fixable?
That's the position we're in now. I mean, we certainly are are wanting to at least work with what we can make some changes that would actually better the system.
But we still believe, as Senator Ragan talked about, the LTSS community, which is the group of people who receive Medicaid right now and are the most acute. And we don't see a lot of progress in their health care. We see a lot of getting their health care stable or making their health care stable. And that's really hard when you're working with a commercial template that is about moving the continuum of care forward, and you're talking about a population of maybe 80, 90,000 people who are on waivers who really would benefit more from control by the state rather than under a commercial insurance template.
What does on waivers mean?
On waivers, now I'm getting into the weeds, but there are 7 waivers
In
across the
Medicaid.
state.
And so these are not the disabled community who
Yes.
Yes, they are.
Yes, that is, okay.
So elderly waiver, mental health waiver,
AIDS,
ID waiver, AIDS, HIV waiver. So it's
Brain
those
injury.
who have the most acute illnesses.
I guess Senator Bolcom had a news conference about legalizing marijuana. You guys are having a news conference about Medicaid, which was a huge issue for Democrats. Didn't prove to be a winning issue. Is this, I mean, how do you go forward as a party on this issue when it wasn't, your position wasn't ratified by Iowa voters?
well, in my district, it was. And I would say that we certainly are not going to discontinue advocating for the things we believe in. We're going to stand up for, the importance of giving fair treatment to, individuals that are needing the services. We also are concerned about the providers, as Senator Mathis has discussed. When you're losing providers, that's going to impact the whole state. It's going to impact all of us. Those of us that aren't on Medicaid will also be impacted if you have a loss of providers. So I think there's still a reason. There's still, a reason to be advocating for the things we believe in, and I think the things that are fair and just.
And as far as it being not being ratified by the voters, I know that, I think you're referring to Fred Hubbell, obviously in the gubernatorial race. Medicaid is a complicated issue, and sometimes it really can't be explained in a 30-second political ad. I think try as he might, Fred Hubbell did explain Medicaid as well, or the Medicaid mess as well as he could. But there were several races across the state that did focus on Medicaid and managed care, and they were winners.
I mean, that's a large race. I'm sure that it's a complicated analysis when you start deciding why someone won or did not win.
So when you say that you're losing providers, I'm assuming that that's people dropping out of the system just because they're not getting paid enough. But I've heard that there are also some organizations, nonprofits, that are actually going bankrupt. I mean,
Right.
They're just going out of
Yes.
business. Can
Yes.
you talk about that a little? What's the concern there? And is there any data that would tell us how many nonprofits, mental health care providers perhaps, or residential care providers that just can't make it under the system?
Well, I think a lot of those things they're sharing with us on a personal level, and they're giving examples to us that they're finding it harder to meet payroll. They're finding it harder to meet the needs that they've served in the past for individuals. There's been reductions in the timeliness of payments, and I think anyone can understand a business model. When you're reducing the timeliness of payments, that's going to put a stretch on your cash flow. And when you're running a nonprofit, which many of the organizations are, just going to your banker is a little more difficult to say, oh yeah, I think this out-of-state for-profit insurance company is going to pay me, but hasn't necessarily been there on time. So I think there's a lot of reasons. I think when you're talking rural Iowa, you're talking, time and energy is even more critical because you know, you have the distance in travel and transportation also.
And in rural areas, this is in direct conflict to what we're trying to do for rural members of Medicaid. If a primary care provider drops out, then that person is going to have to drive farther to get health care, the health care that they need. So really, it's affecting rural communities in their basic access to health care more than it is any other community.
Did Mr. Randall provide updated information on timeliness of payments yesterday? That's supposed to be in the new contract, and they were given extra money to pay those bills on time. Did he provide you any information about what's happened since they signed the contract? I believe it.
He said they were making advancements in that. We didn't see any evidence of it, but they went over the quarterly reports. He did not. Liz Matney did, but I think there was some lack of, you know, exact details for us.
So if we went online, we couldn't find this data?
I think you could, yes. And when you look at that data, I think you need to investigate whether when a bill has been paid or there's been a resolution. A resolution may mean something completely different to the managed care organization than it does to the provider. A resolution to the provider means they're paid for the services that they rendered. And the managed care organization may think that a resolution is that they're not going to pay and it's all settled and it's a no. So when you look at that and it says resolution, you know, you really have to dig down and see what actually happened with that bill.
And then we're going to have the complications of the new company coming out. That was discussed yesterday. But, you know, this is a population that has seen a lot of turmoil on the changes. And so this will be another little bump in the road, as people have said, to, you know, healthcare services across the state.
Are you satisfied with his answer on the building of this new deal will be obtaining in West Des Moines?
No, I'm not satisfied with that answer. I think they do. I think that total care, the optics on that are just horrendous. You know, especially when you have bills that aren't being paid on time and you have people that are still not getting the quality services that they deserve. I think yesterday I said something like, you know, we see a court case where an individual is trying to get a wheelchair, and then you have a managed care organization, you know, leasing a space that's far too expensive.
I mean, at the end of the day, we're talking taxpayer dollars, and I think that's what Senator Mathis pointed out yesterday in the committee. When we're talking taxpayer dollars, we need to be very astute in how we're looking at, and especially we have seen a lot of publication on this, so we'll continue to watch.
You know, when you're talking about workforce too, when the first wave of managed care came into the state, there were several organizations that they pilfered. They came in and said, we'll offer you X amount of money more. So you saw a lot of movement among therapists, social workers, direct healthcare workers. And I think you're going to see that when Total Care comes into town and they really get moving again. You'll see some movement in trying to, you know, I don't want to use the word steal, but in trying to entice the workers over to their side. There is a provision in this bill that talks about the managed care organizations working with the state of Iowa on workforce issues, and especially in healthcare workforce. And it doesn't mean by taking someone else's employees that's helping the workforce. It means training people. It means recruiting people into healthcare occupations, and specifically the more difficult occupations that help Medicaid patients.
And we talked about putting that in future Iowa. I don't believe it's there at this point, but, you know, making sure we build that workforce, especially when we go back to traveling distances and making sure that people have the access.
This isn't specifically about the bill, but there's a number of bills kind of going through the process right now that look at Medicaid work requirements and other like accountability measures for public assistance programs. And I'm curious, how you reconcile that at this point too, when you're talking, I mean, just yesterday there was a subcommittee on a bill that would, kind of force DHS to check in more on some of these public assistance programs, and some people raised concerns, well, we're going to outsource this to another independent contractor, what that might look like. So I'm just curious if you have, thoughts or concerns about those sorts of proposals when you're advocating for Medicaid right now.
Well, I think that from what I understand, there's a cost involved in that, and you also take control out of what we see, because when you start with private companies, you also lose the hands-on that we can do as a state. Those proposals, there's a variety of them, but I think if you look at some of the statistics, you'll see that most individuals are working, and I believe that a lot of the discussion centered around getting information. And so if you can do that within costs, but when you start to spend more than you're actually going to save, I think we should look at that as well, because we're, at the end of the day, talking taxpayer dollars.
And the Attorney General's office has a Medicaid investigator. They go out, they have several actually across the state, where they go to find out if a provider or a member or whoever it might be, that the payment was correct, it was accurate, and it was done lawfully. And they collect, many dollars each year to put back into the Medicaid system. So I think there's a bit of misinformation about the lack of oversight in regard to illegalities around Medicaid.
Right, and most of what we've heard from people is it's anecdotal, and so when you can give us names, those can be turned into the fraud department. I mean, if you give us names, those can be forwarded on. So as opposed to anecdotal and we see somebody doing this or that.
Thank you.
Thank you, guys.